Hello, and welcome to this presentation, Clinical Supervision of Counseling Interns, Theory and Practice, through the Department of Counseling at Texas. In counseling, clinical supervision is defined as an intervention provided by a more senior member of a profession to a more junior colleague or colleagues who typically, but not always, are members of the same profession. When one says not always, it's important to note that this presentation is intended to train not only licensed professional counselors, but our fellow mental health professionals, including licensed psychologists and licensed social workers, in well-researched and commonly utilized supervision methods. It's hoped that this training will be informative and helpful to supervisors from these other disciplines. In the field of counseling, there are two purposes of clinical supervision. One, to facilitate the professional and personal growth and development of the supervisee, and two, to ensure client welfare. Master's students in the Department of Counseling receive clinical supervision during their Master's Counselor Preparation Program, and those pursuing licensure receive post-master's clinical supervision to become licensed professional counselors. Site supervisors, whether they be licensed professional counselors, licensed psychologists, or licensed social workers, play an integral role in the development of our master's practicum and internship students, and the goal of this training is to provide some useful aids and information to help you supervise our students. The supervisor relationship is the heart and soul of supervision. When supervisors can create a safe and trusting environment, supervisees are more open to feedback and willing to share their struggles and challenges. Trust is essential to a good supervisor-supervisee relationship, but many supervisees find it difficult to trust. According to Borders and Brown, each supervisor and supervisee brings unique personalities, life experiences, interpersonal histories, professional motivations, and goals to the supervisory context. Hence, safe and trusting environments take time and effort, and what works for one supervisee may not work with another. The ACA Code of Ethics states that supervisors must have multicultural awareness and explore the effect it has on the supervisory relationship. Supervisors must be reactive to cultural diversity in a supervisory relationship. Specifically, the failure of supervisors to be sensitive to these cultural differences can impact the supervisee and the client in a negative way. There is some evidence that supervisors believe they make more effort to address multicultural issues than their supervisees perceive. In an example, a white female supervisor is supervising an African American female supervisee. The supervisee is working with an African American male client who brings up being a member of a cultural competence committee at his workplace. The client voices frustration with white colleagues as they tease him about not being invited to the meeting based on the color of their skin. The supervisee asks for feedback from the supervisor. The supervisor is reluctant to address the component of race in the example. Consequently, the supervisee comes away feeling misunderstood and invalidated. Perhaps the supervisor could have provided an empathic response, followed by checking in with the relationship between the supervisor and supervisee as they have different cultural and ethnic backgrounds. At the Department of Counseling at Texas A&M University Commerce, we have utilized the discrimination model as a tool for supervisors in training for several years. This model was originally developed by Bernard for supervisors in training, and it provides a simple and practical framework to help supervisors decide what to address and how to do it. One goal of the model is to organize everything that happens in a counseling session and to provide an aid that will help supervisors make decisions about what to focus on in supervision sessions. Bernard identifies 3 areas of focus for supervisors. These areas of focus are as follows. Process or intervention skills are what the supervisee actually does during the counseling session. Process skills include basic and advanced helping skills like empathic responding, confrontation, and the use of silence. Conceptualization or cognitive skills are what the supervisee is thinking before, during, and after the counseling session. These skills include what the counselor or supervisee chooses to respond to, understanding and making sense of what happens in a session, and case conceptualization. And finally, personalization or self-awareness skills are the personality traits, cultural background, sensitivity towards others, and the interpersonal style of the supervisee. Personalization skills include the supervisee's awareness of how personal issues, beliefs, which are often influenced by one's cultural background, and motivations impact the counseling sessions. In addition to these areas of focus, Bernard identifies 3 roles that supervisors assume when addressing issues in supervision: teacher, counselor, and consultant. The teacher role may include sharing information about a specific intervention, concept, or topic that the supervisor believes would help the supervisee's effectiveness. The supervisor might recommend resources to help the supervisee better understand developmental or cultural differences, or use an experiential learning approach such as modeling how to implement a specific intervention. The teacher role tends to be used extensively with novice supervisees, hence it will probably be useful for site supervisors. When a supervisor assumes the counselor role, she usually addresses the interpersonal or intrapersonal reality of the supervisee. An example might include identifying a counselor in training's experience while observing themselves on a recording. In this role, the supervisor uses counseling skills to help the supervisee better understand relational dynamics and internal conflicts that typically occur in counseling sessions. If the supervisee is anxious, which is typical for novice supervisees, the supervisor might listen to, empathize, and support the supervisee, as well as normalize the experience as a part of counselor development. The consultant role is typically reserved for advanced supervisees that are more autonomous and self-aware. They are capable of producing their own conceptualizations and implementing appropriate interventions. With more advanced supervisees, most of the structure is provided by that supervisee. This level of counselor more accurately knows what she or he needs from supervision. The consultant role is more egalitarian than the first 2 roles and places more responsibility on the supervisee. The following slides contain tables with examples of how the 3 supervisor roles are used with areas of focus. In this table, we can look at the middle column, which is the counselor role. Here, we see how the supervisor assumes the counselor role to help her supervisee implement an intervention. In this example, the supervisee is unable to challenge one of her clients. The supervisor asks the supervisee to reflect on the fact that she communicates a desire to help her client, but is not doing what is needed for the client to achieve insight and change behavior. In addition, the supervisor might ask the supervisee to imagine confronting the client. Then, the supervisor might ask the supervisee, "What's it like to think about that?" Now, we ask that you turn your attention toward the teacher role, or the first column. Underneath the teacher heading, we have the supervisee struggling to use immediacy with clients. In addition to the solution provided, the supervisor might choose to model an effective technique by using immediacy with the supervisee. In this table, we ask that you look at the middle column, which is the counselor role scenario. The supervisee assesses a young African American male client at a drug rehab unit as being hostile and resistant. The supervisor reflects the supervisee's fears in working with this client as one intervention to help the supervisee understand what is blocking her empathy for her client, and thus making it unlikely that she will understand his behavior within a larger systemic context. In addition to this intervention, the supervisor might ask the supervisee, "What do you think it's like to be this client at a drug rehab unit?" Furthermore, another intervention might be to ask the supervisee, "What is it like to work with this client?" In this table, we ask that you please look at the first column, which is the teacher role. The supervisee treats his older female client in a manner that the supervisor finds condescending. The supervisor reviews a video recording of a session with the supervisee and gives him feedback about one such exchange, pointing out how this is different from his usual demeanor. In addition, the supervisor could respond, "You seem uncomfortable." Then, the supervisor could ask the supervisee to role-play being the client, and the supervisor could demonstrate a more relaxed and comfortable way of interacting. You may have noticed that we have mentioned a few times that novice supervisees have some unique qualities and needs. This idea of differing supervisee needs is the focus of the next part of this presentation, different levels of counselor development. For the past several years, we've used Stoltenberg's Integrated Developmental Model, or IDM, to help our supervisors in training better understand how to use the discrimination model effectively with counselors in training at different developmental levels. Like the discrimination model, IDM provides a clear and fairly concise framework that elucidates developmental needs of counselors at various points in their training. As you will see in the slides that follow, this model has 3 levels of counselor development. Hopefully, this brief introduction to IDM will be helpful to you as a site supervisor. In IDM, 3 overriding structures provide markers that help supervisors assess the level of professional growth of each supervisee: self and other awareness, motivation, and autonomy. For example, Level 1 supervisees tend to lack self and other awareness because of high levels of anxiety. These supervisees are so worried about their performance and adequacy they have difficulty empathizing with others and noticing their own emotions other than anxiety. Supervisees at this level tend to have low self and other awareness, high motivation, and low autonomy. In supervision, they value support, technical direction, and structure. Criticism for some Level 1 supervisees can be devastating because many have little confidence. After seeing several clients and surviving the early challenges of learning how to be a counselor, Level 2 supervisees tend to have less anxiety and more self and other awareness. The transition from Level 1 to Level 2 can be facilitated or hindered by the supervisory environment and the trainee's personal characteristics. Level 2 supervisees tend to be less preoccupied by performance anxiety and more able to understand the client's world. They develop the capacity to empathize and read nonverbal cues more effectively. Being more connected to clients can be rewarding, but also unsettling because the emotions of the clients have more impact on the supervisees. Managing the complexity of working with clients can be difficult, and supervisees may experience fluctuations in confidence, motivation, and autonomy. Whereas Level 2 is characterized by fluctuations in motivation and confidence, Level 3 supervisees tend to be more stable, autonomous, and reflective. A more complex understanding of the therapeutic process allows Level 3 supervisees to tolerate temporary states of confusion, and past successes have helped them develop more confidence. The focus of supervision with Level 3 supervisees tends to be about fine-tuning existing knowledge and skills. These supervisees are more receptive to input and feedback and do not experience either as threatening. According to Neufeld, effective supervision includes evaluating, teaching, modeling, enhancing awareness, and encouraging exploration. The department believes that these are effective steps in providing supervision, and a more detailed outline of each one of these steps will follow. In the evaluation process, supervisors observe recordings of sessions and consider if the supervisee's behaviors are appropriate for the client in the moment, are culturally appropriate, and are a good demonstration of the supervisee's skill set. After the observation, the supervisor elicits the supervisee's feelings about performing as a counselor. An example of what this might look like is that the supervisee would then ask the counselor in training What was it like to just observe yourself on recording during a counseling session? Then the supervisor explores these feelings and provides validation for the supervisee's thought processes. After observing and evaluating the supervisee's skill set, supervisors will then begin to teach and model new skills to the supervisee. In this mode, the supervisor will first teach a technique, skill, or concept verbally. Then the supervisor will show a recording or demonstrate an appropriate use of a technique with the supervisee. The supervisor asks the supervisee to perform a role play of the skill with various situations in mind in order to assist the supervisee in feeling more comfortable with the skill in question. Then the supervisor asks the trainee to process the experience. This often involves the supervisee's experience of practicing the skill. Another effective supervision activity is assisting the counselor trainee in enhancing their awareness. Trainees must learn to accept and use their feelings towards clients and their behaviors to better understand these clients and, of course, themselves. The supervisor encourages the trainee to notice these feelings and consider their meaning. This can often be difficult for beginning trainees. They often believe that they should always like their client and feel empathy towards them, when in fact at times they may find their client's behavior to be annoying and even have a difficult time empathizing with their client. This also can be a time to challenge preconceived notions about culture. If these preconceived notions can be unearthed and confronted, perhaps they can even be changed. Furthermore, if the counselor doesn't acknowledge these feelings and beliefs, they may wind up acting them out in an inappropriate fashion. If feelings can be confronted and challenged, perhaps this doesn't have to happen. And finally, another effective supervision activity is to encourage exploration within the supervisee. In this context, the supervisee is encouraged to explore feelings within the supervision session. This shifts the relationship between supervisee and client to supervisee and supervisor. In this instance, the supervisor can start with self-disclosure, revealing a hypothesis about the supervisee or even about observed behaviors. The supervisee can respond, and then feelings can be explored further. In this slide, you will find a list of suggested resources that can assist you. While this is not a complete list of supervision resources, we are confident that these references will provide you with enough information to equip you as a site supervisor. This concludes our supervision training. We now move on to the Department of Counseling at Texas A&M University Commerce's Clinical Sequence Orientation. The components of this orientation will include the department's philosophy regarding supervision in the internship experience, specific requirements of interns and supervisors, and useful elements of an effective supervisory relationship. The internship philosophy of the Department of Counseling starts with the belief that all parties involved, including practicum and internship faculty, site supervisors, and site supervisees, all have a stake in this process. This is a developmental process that involves, to a great extent, supervisees following or shadowing not only the site supervisors, but also other staff at their respective sites. It is also expected that supervisees will develop relationships and networks at their site that can be integral toward the development of the supervisee's career. It is expected that supervisees will apply skills learned throughout their coursework within the department, as well as develop new skills observed and practiced at their site. And, of course, it's believed that as supervisees continue to practice and develop skills, they will become more intentional in their work. The Department of Counseling at Texas A&M University Commerce models its program after the 8 common core experiences of the Council for the Accreditation of Counseling and Related Educational Programs, or CACREP. These 8 common core experiences are professional orientation and ethics, social and cultural foundations, human growth and development, career development, helping relationships, group work, assessment, and research and evaluation. The clinical sequence within the Department of Counseling is as follows. Starting with Counseling 516 pre-practicum, supervisees participate in on-campus counseling experiences. These experiences are taught didactically, demonstrated by teaching faculty, and then practiced within class time by students with fellow students. By the conclusion of Counseling 548 Advanced Skills, students will have integrated counseling theories, basic skills in counseling, as well as more advanced skills. At the successful completion of Counseling 548 Advanced Skills, students will then be permitted to enroll in Counseling 551 Practicum. In this course, CACREP mandates that students will acquire 100 total hours of supervised counseling experiences in campus, school, and community settings. Weekly individual and group supervision by university supervisors is required. At the successful completion of Counseling 551 Practicum, students will then be permitted to enroll in Counseling 552 Internships 1 and 2. Within these 2 courses, within 2 semesters, students will acquire 600 hours, 240 direct client contact hours, of supervised counseling experience. 1 hour weekly of individual supervision is provided by the site supervisor, 2 hours of on-site group supervision, and 3 hours bi-weekly group supervision will be provided by the university supervisor. The Community Mental Health Counseling and School Counseling Manuals are required reading for students engaged in the practicum and internship sequence. Site supervisors are encouraged to read the respective manuals to better understand the requirements and processes of the practicum and internship experience. In these respective manuals, one will find, among other pieces of information, preferred experiences for practicum and internship students, appropriate paperwork to be completed in these experiences, and best practices in communication and remediation. Links to the respective manuals may be found below. In conclusion, the Department of Counseling faculty and staff would like to thank you for your significant efforts in training our practicum and internship students. We realize that you have busy careers and personal lives of your own, and yet you take on these interns with open arms. We genuinely appreciate you and thank you. This concludes the Site Supervisor Orientation for Community Mental Health Counseling students. We hope you've acquired some useful tips in providing supervision to your supervisees. If you should have concerns or questions moving forward, we encourage you to contact the Director of Training and Placement, Dr. Linda Ball, at linda.ball@tamuc.edu. Thank you again for your service as a site supervisor of the Department of Counseling at Texas A&M University Commerce.